dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunitz, and our topic today is suicide prevention, intervention, and postvention. My guests today are Allison Sharp, who is a psychotherapist who specializes in suicide prevention, intervention, and postvention, and working with survivors of suicide loss, and Debbie Baird from the National Alliance on Mental Health, New Hampshire, called NAMI-NH, who works with the Connect Suicide Prevention and Postvention programs, offering training and assistance to communities in planning and implementing best practices. She also is the primary contact for the New Hampshire Survivor of Suicide Loss community, providing resources and supports, one-on-one outreach, coordinating and training the Survivor Voices Speakers Bureau and the Loss Survivor Support Groups in New Hampshire. Welcome.
Thank you for having us.
And I'm so delighted that you're here. And ladies, one of the things that I really would like to ask personally from you is why you decided to devote your life to this very important work. So from a personal basis, if you could share that with our listening audience, I think it would be so appropriate because it is such a tender, heart-wrenching topic. Which one would like to go first?
Well, I'll go first.
Okay.
Well, back in 2009, I lost my son, Matthew, to suicide. He was 29 years old. And we say that it came without warning in our family. However, within the year after his death, we quickly learned that it did not. And it was my point of view to make sure that I helped others recognize the warning signs, to be able to help others who are feeling suicidal and being able to get help. So that's why it's important to me.
That's wonderful. And how about you, Allison?
So I was a clinician first. I've been in the field since 2000, and just practicing.
It's okay.
And in 2011, I lost my brother Douglas to suicide. And even though I'd been doing this work, I felt like now having this perspective, being a loss survivor myself, and understanding what it feels like and what he must have felt like from a very different perspective than I had before. I don't know that I appreciated it, if that's the right word, in the same way that I do now. And I certainly want to work hard so that nobody has to suffer the way that he did, and so that there are fewer survivors. I think it's an incredibly preventable, treatable depression. My brother suffered from depression. Very treatable illness.
No, I understand that what you do is from the heart, and your personal experience has literally propelled you in serving others to help them and to support them and their families.
Absolutely.
And I greatly appreciate, it's not always easy for someone to share this from both of your perspective on a personal basis, but it really allows you as human beings to come from the place of the heart and have an understanding that goes beyond those that may have never understood the extent of the pain and the suffering and the anguish that goes with this. So I thank you both for sharing that with us, and because I know it's not an easy thing to share. And grief is something that continues through a lifetime, and healing is a process that goes through the whole journey. But this is, the word suicide can be very frightening. And what people don't necessarily understand is what to look for. And Debbie, you mentioned that. One of the reasons why you've decided to be involved was because later, after the year, you realized that maybe there were signs that you may have missed. So could you share that with us? What is it that people should look for?
Well, let me just add that, saying the word suicide is very frightening and it's very scary to many people.
It is.
And I think it's because we don't understand what it really means. So we tend to avoid it. Even those who may be suffering in silence from depression, my son did, Matthew did, and or families who just don't want to talk about it and don't know what to do. So we tend to avoid it, we tend to steer clear of it, and the whole purpose is to talk about suicide.
Exactly.
And helping to raise the awareness.
And I think it's important to note, too, that if somebody's feeling suicidal, oftentimes people don't want to ask if they're feeling suicidal because they're afraid it's going to plant the idea in their head, and that's the furthest thing from the truth. And if somebody's sitting with something that terrible, that powerful, and so stigmatized, to have somebody ask, are you feeling unsafe? Are you feeling suicidal? Won't plant the idea in their head because it's likely already there, and there's often relief to be asked.
Right. You're absolutely right. And some of the risk factors that people can look for are definitely changes in behavior of that particular person. If something's different than what they normally would do, or if you see agitation or anxiousness, feeling hopeless or isolating themselves, not talking to others, staying away from interested activities that they used to be a part of, like school activities or even work, decline in work interests and so forth. And so if you're seeing some of these signs or risk factors and you know this person, I wouldn't be afraid to ask if they're thinking of taking their own life. And if they say yes, don't be scared by that. Take a deep breath, be as calm as you can.
And what should people do? What if they ask and learn when someone says, yes, I am
Ask them
thinking
if they have a plan. Ask them how, where, if they have means. And then be able to stay with them and not leave their sight and keep all eyes on them until you can get them to help.
And how might we get them help?
Allison?
Okay, so I think it depends on the situation. If they're acutely suicidal in that moment, I would, try to talk to the person about encouraging them to go to the emergency room to get an evaluation. If they're not inclined to do so and they're resistant to that, if you can't convince them to do that, then ultimately you would need to call, the police or 911 to have someone escort them there, because I always tell people, often with kids, they'll say, I don't want my friends to be mad at me. If I tell, I don't want them to be mad at me. And what I say is, better they should be angry with you and be upset with you than to not be here and to be dead.
Absolutely.
And so it's not ideal to have to force someone to get help. And obviously, I always try to work with somebody, literally hold their hand if I have to get them to the ER. But if that can't happen, then I'll do what I need to do to have an intervention.
From a professional point of view, between the ER and the police, how well do they deal with people who are suicidal?
I think it depends on where you are and on the situation and on the individual. I know NAMI does a lot of training with first responders on sensitivity and language. I also can tell you, professionally hearing stories from my clients that some of them haven't been treated well and that they wish that there was a little bit more kindness and sensitivity and less aggression when it comes, to first responders.
So we understand that suicide is frightening and scary, and it is a very tender and heart-wrenching topic. It really crosses all life situations, all people.
Doesn't discriminate.
It
No,
does
it
not
doesn't
discriminate. And I think that's
Absolutely.
important for people to understand. And we're seeing a rise in suicide related to statistics. Do you know any of the facts related to it in New Hampshire? How many suicides are?
Well, I want to share that in part of our training, we do share a little bit of data in training, and we try to keep as much updated with it as we possibly can. And I can say that it is across the lifespan here in New Hampshire, the 9th leading cause. And it is the 2nd leading cause of ages between 15 and 34. It was a
quite a
little
range.
higher, but it has gone down a little bit. So efforts are happening, but we still need to do more. And I think being aware and raising, having education and raising awareness to this subject, and not being frightened to talk about suicide, not dropping the hot potato, and making sure that people are getting the help that they need, but recognizing also that it's not any one risk factor that could cause somebody to become suicidal. It's a combination of many different ones. With youth, you may see it in writing, or they may talk about it. Sometimes we hear, well, I wish I were dead, or, if this doesn't happen, I'm just going to kill myself. And how do you take that seriously? Sometimes children don't take it seriously. They think, oh, you don't know what you're talking about. Sometimes it can be a sign that you really should take it seriously. I will share in all the times that I've trained in suicide prevention and postvention, our youth leaders today, which we do have a really great training program for, they get it. They really understand. They tell us we don't understand sometimes, but they do get it, and they want to help their peers to understand and recognize the warning signs and be there for them. And I'm like what Allie said. I'd rather somebody be upset with me, never talk to me again, than not to have them with me.
And when you gave the range of 15 to 34, that is quite a range. It really is. Were you just going to pipe in and say something?
Well, I was going to also just talk about, co-occurring disorders too. If you have risk factors include, other things like if you have a history of depression, bipolar, schizophrenia, other mental illness, if there's substance abuse, if you have a history of suicide attempts in the past. I mean, all of these things combined, contribute to the risk factors.
And in our state of New Hampshire, we are definitely seeing an increase in opioid-related use as well as deaths. And so it's sometimes hard to know if it's been specifically because of overuse of the medic or related to suicide.
Right.
So when we talk about the ages of 15 to 34, and you mentioned about the youth group, what is the prevention awareness that's being done within the schools? Because the youth themselves are with one another, right? Are they, as well as the faculty and other people in the schools, are they being given information to help them be able to ascertain if there might be a problem? Because sometimes you hear of some young people making a pact. If one commits suicide, then the others will follow. What is being done related to that form of prevention and education?
I'm really glad that you asked that question. There's been many best practice programs in the state of New Hampshire within our school systems. NAMI New Hampshire has their Best Practice Connect program, which is suicide prevention, postvention, and we have a youth leader training. We don't just go into the schools and just train students. We train adults first, because we want the students to know they have someone to go to, and that if they don't understand, an adult can't be trained or understand what they're going through, then they don't have anybody to go to but themselves. And even though they share amongst each other, it's nice to know that you have a trusted person, an adult, or another friend that can help you. So in many districts, school districts across the state, I do know that the Connect program has trained hundreds and hundreds of faculty, administration, down to bus drivers, cafeteria workers, janitorial, and also students. So
hopefully school nurses too.
Counselors, school counselors.
Good.
Many, along with other diversities, but within the school systems.
What does that training involve when we talk about suicide prevention and education? What does that mean? What does it involve?
Well, it's simply just helping to raise awareness of what is around you and be mindful, making sure that you understand maybe some signs of depression or other symptoms that you're not really aware of, or we tend to avoid when we see something different. Whereas this way, it can be recognized and maybe something can be done about it and sent to the right person.
And I think in addition to the training, at the end of the day, it's just about conversation.
Yeah,
So I mean,
absolutely.
you need the education, but even having a format like this and, kids being able to give it a voice, right? And just normalizing that people sometimes feel badly. Sometimes people feel like hurting themselves. And giving people an opportunity to say,
It's okay to talk about
it's okay to talk about it. And the more we do that and the less stigma there is, I feel like the problem will solve itself if we can just talk about it. I mean, when you think about 40 years ago, 50 years ago, nobody would say the word cancer without whispering it.
Right.
And it's the same thing with suicide.
Right.
No, it's suicide, it's depression, it's mental illness, it's there, and we need to talk about it.
It's so important that we talk about it because each human life is a precious life, and for someone to get to the point that they are either full of anguish or not able to anymore want this experience of the earth experience and then want to leave it,
Right about that.
very alone. They must feel very alone, very isolated, and these.
And there's guilt and there's shame and there's a sense of being a
Hopelessness.
burden and hopelessness.
Yeah. So the sensitivity to this is critical. So
Absolutely.
we talk about suicide prevention, and how does the state of New Hampshire and the other New England states kind of rank in suicide prevention as far as
Well, I'd like
what
to
we're
be a little proud about
proactively
that.
doing?
I also sit on the Survivors of Suicide Law Subcommittee for the State Suicide Prevention Council. And I also am a committee member to the Communications Subcommittee as well, where I like to help practice safe messaging and safe languaging and helping to keep raising awareness about suicide prevention and suicide loss. The great efforts that the council is doing is wonderful, and if I could give a little plug,
Please.
our New Hampshire State Suicide Prevention Conference is November 4th, and we are having a wonderful poster session of every one of the subcommittees that is on the council. So I'm excited to share this because we are doing great work in this state. We're sharing a lot of great best practices programs, and it's not just through NAMI, it's other programs. We have just had the American Foundation for Suicide Prevention chapter start here in New Hampshire in October of last year. There has not been a chapter for quite some time, although NAMI New Hampshire has practiced a lot of their programs. We still work with a lot of their programs, and it is a great resource for loss survivors, but also those who possibly have attempted suicide or are feeling suicidal. There's a range of resources and supports out there, but the council itself is really doing a great job at making sure best practices are in the state of New Hampshire and continuing to.
So can you give an example of best practices?
Well, making sure that we have the Connect program, which is a suicide prevention program that started long before I came to NAMI, about 10, 15 years ago. And it's copyrighted through NAMI, but it's a program that teaches you to be safe and making sure that when you're giving, recognizing warning signs, risk factors, protective factors, with adults, with youth, and other diversities such as law enforcement, faith leaders, counselors, health clinicians, mental health, other practice primary care, and so forth. We make sure that every one of the protocols that we're putting into place to make this Connect program are practiced in the best way. And the Suicide Prevention Council will not allow a practice like, if it's not best practice, it won't be in New Hampshire.
Very good, very good. And how do we compare to the other states in the United States?
I like to say we're doing great work.
All right.
Many people say to us, oh, they're doing great work in New Hampshire. We focus on New Hampshire. And we do like to learn about other states and what they're doing, but we focus on New Hampshire.
Now, you said something before, messaging,
Safe messaging.
safe messaging. Let's talk about that. What does safe messaging mean?
There's a right way and a wrong way to
And
talk
what's the
about
right
suicide.
way and wrong way so that we can help
Probably the most common phrase you'll hear is commit suicide. And that's no longer the language that we use. We want to say something like took his or her own life, died by suicide, because when you use the word commit, it has a connotation of a crime or a sin, and it's more stigmatizing and
Okay.
it's more polarizing.
So the way to say it would be?
Died by suicide, took his life, took her life. I'm sure there are
And we
others.
hear from, killed oneself.
Killed oneself.
We hear from many loss survivors who do take offense when they hear somebody say that, oh, I hear so-and-so committed suicide. I think it is because it becomes sensitive to those who have lost a loved one. When you think back, it can be traumatizing, but at the same time, it's the sensitivity of the subject. When I said earlier on that I became very mindful of people around me, and it's for that reason. I didn't recognize these signs in the beginning, and so when I did, I wanted to make sure that I was vigilant and not saying certain things, but also recognizing if somebody's in distress and at least being comfortable to say, are you okay? And showing my care and concern. So I think that's mostly part of what we try to do. And we try not to talk about the details or because it is traumatizing and it can re-traumatize the more we talk about it. The commonality is the word suicide.
And it can feel voyeuristic when somebody wants to know the details. It's a little less about what happened than about curiosity. And so if you're trying to be supportive of someone, you want to be there for them, not sort of feeding that curiosity in yourself.
So the best way to be there for people would be what?
Honestly, I think just listening.
Being present.
Being present.
Really listening to understand and showing your caring and your love.
I think at the end of the day, people want to be heard. They want to be known. They want to tell their story. And just having a space to do that is incredibly healing. And having multiple spaces or many opportunities to tell your story over and over again is incredibly powerful and incredibly healing. And so if you're trying to be a support for somebody, listen to them. Let them know that you're there. Offer to go for a walk with them. You know, with online and internet, you see all these things. What never to say, what always to say. You see these posts about things you should never say. And I think as long as you're being genuine with somebody, that's what's important. And if they understand that your intent is to be supportive, that's what
And they will know.
counts.
They
Absolutely.
certainly will know. And you know, Allie mentioned earlier that by talking about suicide, you're not going to put the idea in their head. In fact, there's proven statistics through the National Suicide Prevention Lifeline and some school-based programs that, in fact, you don't. And so knowing that, I think that is really, very helpful. I don't know, I think what Allie said is really true, just being there, being the caring person that you are. And sometimes when you do ask if they're feeling suicidal, I think it's a relief for them that somebody, oh good, I'm not keeping it inside anymore. And they do feel okay to share that with you. We hear that a lot through loss survivors.
And I think my perspective is that most people don't want to die. I think most people want the pain to end. And when you are that desperate, when you're that sick, when you're that sad, when you're that hopeless, you can't see that there's another way out. And I sort of, I don't really love this phrase, it's a permanent solution to a temporary problem. I don't love that phrase, but it's true. You're taking steps to end your pain that are permanent when you take your life. And if you can get somebody to even have that extra 2 minutes to say, come with me over here, let me hold your hand, let me get you help.
So that's where intervention comes in. So let's talk about intervention. So what are the best interventions? Where do people go? What do they do if they begin this dialogue and conversation? Because it might make them a little scared themselves. Oh my goodness, I'm with somebody that's feeling this way. What do I do?
I think the very first step is just being able to ask for help or get help and knowing where to go. And that can be anywhere from, obviously seeking professional help from, a psychologist or a counselor, talking to your primary care doctor, talking to your clergy person, talking to a friend, just somebody who can get the ball rolling initially. I think obviously getting professional help at the end of the day is the best bet when you're feeling suicidal, but whatever it takes in the moment to get someone connected with somebody who will listen is the most important step. And then after, treatment can begin. And that might involve psychotherapy, it might involve medication, meditation, mindfulness. There are a lot of different treatment approaches.
Absolutely. And the urgency of it once the discussion begins. People should really respond fairly immediately, correct?
If
Versus
somebody's
putting
saying
it
they're
off?
suicidal,
Yes.
absolutely. I mean, you can't wait.
You can't wait until tomorrow or the next day. You really need to get right on it and get the intervention needed.
Get the intervention. You want to make sure you remove lethal means. You want to ask them if they have a plan. You want to ask them if they have intent. You want to ask if they have access to weapons or
Or drugs or anything else that might So now the reality is that sometimes when people find this out, it could be on the weekend and the providers might not be available when you said to go to the provider or whatever else. And that's where anytime,
ER.
if you can't go to your primary care provider,
Go to the ER.
you go to the emergency room.
You can call the suicide prevention hotline.
And what is that,
That's-
suicide prevention hotline?
The number is 1-800-273-TALK, and that's 8255.
Say that again, please.
1-800-273-TALK, 8255.
And when someone calls that number, how are they received? What happens? What are the people like on the other end? Are they ready to go to help? And
They're ready to go. It
Is
a
that
national
24/7?
It is 24/7.
And it's
a
national?
national lifeline. Actually in New Hampshire. It's answered here in Lebanon. It's a place called Headrest. It's
Okay.
also, there are other crisis lines that are answered there as well. I do know that when anybody can contact that line, whether you're feeling suicidal yourself or you know of somebody else who may be and you don't know what to do, or you have a family member that you want to help and you don't know where to go. They will help guide you. They will send you to places and people to help you out. And what's really nice about the one in Headrest in Lebanon is that they do follow-up calls afterwards.
wonderful.
They at least try you 4 or 5 times to make sure that everything worked out well for you. And that's important to know because not very many people know where else to go. So remembering that line is good.
And Debbie and I were talking earlier, about sort of this generation with anxiety and,
Yes, and stress.
actually, and just being able to pick up the phone and call and talk to somebody. There is also a text line, which is 741-741, and you can just text the word START or text the word HELP, and somebody will have a text conversation with you.
Really? That's excellent.
It is. I do think that it's hard for some people to actually pick up the phone and verbalize, but it's very different to have a screen in front of you
And write a
reach
text.
out for help.
And then somebody would respond.
Yep.
And they respond right away.
Yep.
So it's man 24/7, or woman to whatever
Yes.
it's covered. Now, from your perspective, being a psychotherapist, what have you found from an intervention point of view? Because it's not only the intervention at the time that you know, because it's an intervention that goes through a lifetime, isn't it?
Right.
To provide support. What has worked and helped people the most?
I think it depends on the person, obviously, and different approaches work for different people. And I always tell people you have to shop around for a therapist. You have to find
What
a
do
good
they look
fit.
for? What do they look for in
Well,
finding
they
that
look for a good
fit?
personality fit. They want to know, do they share, similar orientation? Are they going to be offering cognitive behavioral therapy or mindfulness, person-centered? Kind of educating yourself a little bit about who you'd like to work with always helps.
And how quickly can people get into with a therapist and get those supports? That's another issue that's very concerning.
It is. It's hard. And,
Yes,
and
because
a lot
people
of
need help right away. They don't want to wait. That's why they've gotten
They
so
do.
desperate.
They do, and it is hard because oftentimes there are waiting lists.
So what do they do in between? While they're waiting to get help, where do they go to get help?
Talk to your primary care, talk to your clergy, talk to your family, talk to your friends. Call as many treaters.
To refer to whoever they can.
Yep. Call as many offices as you can. Get on waiting lists. Do whatever you need to do. You can access the lifeline. Whatever you need to do in the moment to stay safe.
Now that lifeline is,
1-800-273-8255.
let's repeat that again, please.
1-800-273-8255.
And that lifeline is there at any time to reach out
24/7.
for help. So we have prevention, intervention. Let's talk about postvention. What does postvention mean?
It means help for those who, after a suicide death. We train similar to we do with suicide prevention, although we help teach diverse audiences how to react and how to act after there's been a suicide death.
So then are you providing resources to the families and the friends who have experienced a death of a loved one?
And the coroner's office in New Hampshire does that as well. So when they know that there's been a death by suicide, they actually send out a packet that has.
It goes to the next of kin. It's full of resources for survivors of suicide loss. Actually, NAMI, New Hampshire, puts the packet together, and we give it to them. And when it's been a confirmed suicide death, the next of kin, if it's been in New Hampshire, a suicide death, the next of kin gets that packet. I also have the accessibility through NAMI to give that packet as well. If they were not the next of kin that the person lived with, I sometimes will give that packet out if I know they need that.
And what type of supports are they given?
It has a book called Coping with Suicide Loss that gives a lot of information about how to talk to children, how to, what to expect, the normalcy of what you're experiencing after the shock and the numbness, the unbearable pain that you're going through. It does give a lot of great resources as, who to contact, as we had mentioned earlier. There's a wonderful CD in there that is made up of loss survivors and music that they give. And it's through Michael Whitman. He put this together. He's a loss survivor. He lost his son. And he coordinated along with other people to put these CDs together. And what he does is he fundraises to have the CD given for free. So that goes in every packet. There is also some other resources and phone numbers and such to contact. And then there's a letter in there that they can send back to NAMI to either be put on the mailing list, to have other support like one-on-one outreach, which is also what I do. And then there's a book that can be given if they ask for it, also for free. It was written by a loss survivor named Catherine Greenleaf. She's a double loss survivor, and what she does is she put this book together. It's of daily affirmations of how to take care of yourself during the day and what you're going through. I read it today still. Yeah. After 7 years, I still read it. And she gives it for free. She also raises funds to have it printed to give for free for loss survivors who request it. And there's other resources that we have, the connectprogram.org, and that is a wealth of information for suicide prevention, but also for loss survivors. And that actual resource packet, of course, the CD is not there, but that information is also on the website, so they can see that. But there's other resources through that website.
And I think just the beauty of the internet is that you can find what you need just by going online, and it's so much more accessible to find help in your area. When I started out, my brother did not die in this state, so I didn't have that benefit. So I went online, and I immediately found the Survivor Loss Group in New Hampshire and NAMI and American Foundation for Suicide Prevention, and was connected immediately.
We're connected immediately.
You just have to look for it.
What helped you the most, Allie, through that process, which I'm sure was devastating?
Many different things. I mean, I had a lot of support from my family. That was first and foremost. I gave myself permission to take time off from work. I went back to work fairly quickly. And then about a month or so back into it, I was on call, and I got a call from someone who was suicidal. And it hit a little too close to home in terms of my own experience with my brother. And after that, I decided I don't think I can be present for people in the way that they would need me right now. And I gave myself permission, and I took some time off. I took about 3 months off from work, and I just used that time to go to therapy.
And to heal.
To heal.
Yes.
Go to therapy.
Which is
I did a
important.
lot of yoga. Yoga saved my
That's great.
life at
Yoga's
that point
wonderful.
in time. It really is. And just allowed myself to sit and to grieve. And I feel like we live in a society, unfortunately, that's so fast-paced that we don't always give ourselves the opportunity or have the opportunity to grieve.
We must take that opportunity because
We
grief
have to.
is an important process. It
It
really
is.
is, and everybody grieves in different ways and
Yes.
different times.
You're right.
It's not. I think a lot of times we want to put everybody in a little box and say this is the
Right.
cookie cutter way it's going to be, and it doesn't
It's
work
not.
that way. Everyone has a different timetable. They need to be supported and respected and cared for to be able to do it the way they need to do it.
And I tell people that grief, people think of the stages of grief, and I
Right.
say they were never meant to be actual stages that you go 1, 2, 3, 4, 5. And I liken it to a spiral staircase where you're
Yes.
going to travel up
Yes.
and you're going to travel back. And hopefully you don't go back down to the bottom each time, but you're going to have different points in time where you experience anger and depression and bargaining and denial and anger
Yes.
and all of that. But that it's a process, and there's no right way to grieve, there's no wrong way to grieve,
Right.
and that you need to be able to listen to yourself and see what works for you. And if that means that meditating or therapy or dancing or
Right.
lighting candles works for you, whatever it is at the end of the day, you should do it to take care of yourself.
And how about for you? What was helpful for you?
Well, it took me a year to really be able to grieve. And I don't say that lightly. When my son died, I lived in Vermont, and he and my daughter both live in Manchester, New Hampshire. So immediately within 3 months, I just said to my husband, we need to move. I need to be near my daughter. And we just had a 5-month-old grandson, so I can't, he will, I hope someday I can tell him the shining light that he was to me once we got here. Once we got to New Hampshire, within a year, is when I fell apart. Yes. And I really crashed. I was a real estate broker beforehand, and I could not function, like Allie said. It's a, you know, when you're in a position where you have to be thinking constantly and you have to be there for people, you instantly know you can't be there for people. So I went online, I looked up American Foundation for Suicide Prevention came up first. I looked into some information for that, but recognized it wasn't local at the time. And then NAMI was right there below it. And I started with a support group. I've not looked back since. Mm-hmm. I think it's been my saving grace, along with my daughter, my husband, and my now 2 grandchildren. And I think that I find great support and healing and helping my family with the work that I do. Mm-hmm. It's important. It's really important to me to raise awareness, but also to make sure that those who have gone through this terrible situation, you know, can be helped and not feel isolated and alone.
Yes.
And if I could help just one family not to have to go
One
through
person.
this,
Yes.
it would help. It would make me feel so much better.
I always say everything that we do is one heart at a time. One heart at a time. And if we reach one heart, we've done our, you know, our duty and compassion of human life and being able to be there for one another. But it truly is one heart at a time, and not to give up on that ever. So let's talk about those people who have attempted suicide and the supports that are available for them, as well as their families.
I think it's the same thing, seeking professional help. You know, you can do it at different levels. On an outpatient level, in therapy once or twice a week. There are intensive outpatient programs where it's daily treatment. There are partial hospitalization programs that are daily as well. And
Are
then,
they
of
easy
course,
to get into right away? Because if
depends on your insurance. It depends on how many beds or spots they have available. So sometimes you have to be patient. And so when somebody
diligent.
and diligent for sure.
Very
And
diligent.
you know, hopefully you'll find somebody who will help advocate for you, because I think if you're feeling sad, if you're feeling depressed or anxious, that's a lot of work to be on the phone with the insurance companies or to be calling offices and saying, I need help.
yes,
And just to have somebody either help you with that process or to find it within yourself to kind of stick with it so you do eventually get hooked up with somebody. There are weeks where people call me and I'll say I have a 6-week waiting list, and then, you know, the tides turn and I got a call this week and I was able to see somebody 2 days later. So it just really depends on scheduling.
but that, you know, that can be very scary for people too.
Very
All of a sudden
scary.
their families are going along and they're thinking everything's fine. They may have missed those little red flags that may have come up, and all of a sudden, boom, somebody attempts to commit suicide, and you're at least able to get them to the support that they needed so that they could get immediate intervention related to the emergency room. But then where do you go from there? And the resources and the help, not only
After-
for the person, but the family members who might not have realized what brought this to this point, and what supports are available for them also, because they're.
I would think the same, you know.
Yeah.
So
finding-
what?
but there
Where
are
could they call and what could they do?
Well,
The first place I always refer people to is their insurance company to find out who's a provider in their network.
Okay.
Because oftentimes people will call and you don't want to waste their time to say, I'm sorry, I'm not in your network, and a lot of people can't afford to pay out of pocket for care. So start with your insurance company, call them, find out who's in my area, who's in my network, and then you take that list and you just start calling.
you can
I
also
also-
contact, oh, I'm sorry, Ally. You can also contact NAMI New Hampshire and their information and resource line. And
Is there a particular number for that?
It's 603
Okay.
225
225
5359.
5359. And when they call NAMI's informational line, how will NAMI help them?
Well, the call will be answered. We have to remember that we are not a crisis line number. However, we try to help find it. We have a wealth of information and resources, similar to what Allie suggested with calling their primary care. You can actually contact different therapists, counselors, and so forth through this other line, online intervention. And I think it's on our website, and that's the NAMINH.org website.
Okay.
However, the contact person would be able to help guide people. We can't recommend therapists or counselors and so forth, but we can guide to people such as Allie or other providers that are in the state.
And a lot of counselors advertise online as well. So you can look up profiles on a website like Psychology Today or something like that. And then you can actually, some people have a picture up and a little bio, and you can read through and see. You can select filters that, I'm looking for somebody to help with depression or anxiety or whatnot. I want a male, a female, this is the area I'm looking for. But then you can read their bio and just see, do I click with them? Do they sound like somebody I'd like to sit down and talk to and that I can be open with? And that's where I was saying sometimes you have to shop around. Sometimes I'm not everybody's cup of tea, and if I can't help you, I want to connect you with somebody who can.
Yes.
And people will often come in and say, it just wasn't a good fit. Well, it's the same thing with jeans. You got to try on a bunch of different pairs in order to find a good fit.
Not to give up and keep trying.
Not to give up and
Absolutely.
keep trying. So, supports, does NAMI have any group supports for those who have tried to commit, where they
We
could
do
go?
not.
You do
We
not.
do not, no.
Are there any group supports within the state of New Hampshire or in New England, Massachusetts, surrounding areas that people could
I'm
go
not
to?
familiar with outside of New Hampshire, but we do have a couple of peer support groups over on the seacoast that do deal with those who've attempted suicide.
Okay.
It's with suicide loss, it's the same. It's very a touchy subject. You're not alone. However, I will say that New Hampshire is trying to put together a task force to help those who have attempted suicide and to be able to be there for support.
It's critically important. Support to them as well as their families,
Absolutely.
because you've changed
Absolutely.
So what's available for the families for support so that they know now how to help and keep a watch out and be there for that loved one? Because now they're on heightened awareness. Oh my, there's now something that we need to begin talking. Where do we begin talking, Allie? Where do we begin talking when someone, your loved one has tried to commit suicide and you're in the emergency room or in the hospital and you've gotten them to the other side of it where they've actually lived? Where do we begin that conversation?
I think just being candid, and first and foremost just talking to your loved one and letting them know that you're there and that you love them, and that, not that it's normal, but that it's okay.
We're here to help you.
And
We'll
that
be
we're
there to go
here,
with you.
we're here to help. I mean, I really do think that's the very first, is acceptance and understanding and compassion. And I know that sounds a little touchy-feely, but I think at
It's
the end of the
important because the
day,
whole subject is touchy-feeling in the end when you realize that it truly is.
it is, and there might not be a lot of groups specifically for attempt survivors, but there are a lot of groups, just the peer support groups, right?
Support groups.
And you can look up depression and anxiety groups. You can go online and find an online group. I mean, there are a lot of preventative services if people want to connect with that.
At what types of preventative services?
There are just a lot of online groups. You can search different, like chat rooms. Do they still call them chat rooms? I don't know if they call them chat rooms.
I think so.
Online
chats,
forums
yeah.
and stuff like that.
But are they run by competent professional people?
Some are just peer driven,
Okay.
and I don't actually know off the top of my head if I'm sure there's something out there run by a professional.
I'm not,
but
I'm not really certain on that either. But
I'm not, but NAMI has the peer support group, and don't they have a parent group for parents who have
We
kids
have-
with mental illness?
Right. We have family-to-family supports, and we also have Parents Meeting the Challenge, which is part of our program, because NAMI is a nonprofit organization. We're a grassroots where we help families who are affected or individuals who are affected by mental illness. And those who can be, even those who may have attempted suicide, can attend these groups because their loved one has been suffering from a mental illness, even though they are working tirelessly to help them get the help that they need. So I think the support for family members is there through this, and anyone can train to be a facilitator for that group or just attend to help themselves, in also with children. They have connection groups with that.
So earlier we talked about the stigma related to those who have died of suicide or whatever. Is there a stigma attached to those who have tried to commit suicide or to?
I would imagine so.
And
because
is it
people
more
feel-
difficult for them,
I think
having
so.
survived?
I think so. I think people feel judged.
Yes.
You know, and I try to explain it to people in terms of when you're feeling that sad, when you're feeling that hopeless, when you're feeling any heightened emotion, we tend to act. If you're really happy, you might go out and go on a spending spree. If you're really angry, you might say something that you would regret later. And, you know, people act impulsively too when they're feeling sad or hopeless. And so just putting it in that perspective, I think, can help that when we have heightened emotion, sometimes we act impulsively. But that understanding that there are ways to stop and take a deep breath and get the help that you need. And again, normalizing that emotions are human.
Right, they're
and that
real.
They're normal, and that you shouldn't be afraid of the sadness or the anger or the anxiety, and just find a way to deal with it. Find
You don't
help.
have to be alone with it.
You don't have to
See,
be alone
that's the
with
thing,
it.
because I know from my perspective, you never want people to feel helpless or hopeless or alone. I think it's so important that we provide the supports that they need in every walk of life, so that they don't feel that way. I worry sometimes related to those that have tried and haven't been successful on what we need to do to provide more supports that may not be there as they may be for those who have.
Well, if you don't mind, I'd like to share something that's,
Please.
It's been a really important program here in New Hampshire. We have an aftercare liaison at the New Hampshire State Hospital.
Okay.
And what she does is she works with those youth currently ages 24 and under who have come into the hospital, who have attempted or made a serious attempt to suicide. They're in the hospital for a certain period of time, depending on their care treatment program. And then she helps to transition them out into the community with their family, along with their family members, to help them all as a unit to work together with
Did not know
protective
that.
factors, helping with warning signs. There are and other places for family members to go to,
That's
so that they can.
fantastic.
But she works within the community, and she works within the mental health centers in the area that they live in.
And that's in
to help
Portsmouth?
them.
Where?
It's out of New Hampshire. The state hospital is in Concord.
So can she go to other communities to help them have similar
Currently,
programs?
right now, she's, as of today, will be over, but she works within 3 different regions, the Lakes
Okay.
region, the Concord area, and the Manchester Greater region.
What do you mean it'll be over?
Well, this program that I'm talking about came in under the Garrett Lee Smith grant, which is part of the project.
So it was effective, it was helpful,
It was
and it
helpful.
worked.
However, the nice thing about it is that the hospital is sustaining this position,
Excellent.
so that now we'll go across the lifespan, hopefully. We don't know the specifics yet, but at least it will still stay with 24 and under. We'll know soon if it will go a little bit higher. However, she just has done a wonderful job of learning community activities, programs for after school, anything that she can help find. She finds their interest and then helps to guide them from that point on.
And this
With
is
the
anyone
family.
who's come into the hospital related to attempted.
Yes.
And is this any particular hospital or all
Just
hospitals
not-
in the state
no.
of New Hampshire?
No, just New Hampshire Hospital.
Just New Hampshire
New
Hospital.
Hampshire State Hospital. It's a involuntary hospital. So if you have made a serious attempt, then that's where you go.
Is there any way that we could get each of our local hospitals in the state of New Hampshire to become a role model like this and embrace this and take this
Of course,
on?
we would love that to happen.
All right,
Of
well, let's
course, we
work for
would love
that.
that to
We
happen.
need more beds.
We need more
We
beds.
need
It's
more
absolutely
beds,
right.
but we also need more guidance and direction and support. So how might we get that? How might we start this to happen in New Hampshire?
Like we are right now, start the conversation.
Start the
Start
conversation.
talking about it.
And understanding and taking it from a holistic approach, right? That, we don't, mental health doesn't go from the neck up, right?
No.
We are complete
We are
beings.
mind, body, and spirit, and
That's
we
right.
do not have
Absolutely.
excellent health without
Without
mental
mental
health.
health.
We must have both, and it's
Absolutely.
critically important. And mental health issues that arise are all part of the human experience.
Yes.
It's because it's based upon feelings. It's based upon how we react or respond to the life situations that we're going through, right?
Taking an integrative approach, I think,
Is critically important.
Absolutely.
And for you, an integrative approach means what?
really all parts, mind, body, soul,
Exactly.
right?
Exactly.
You have to attend to everything from what you put in your body in terms of diet to your paying attention to your emotions and your mental health, to your physical health, to your spiritual health. I mean, I talk to people about thinking of it as wedges of a pie,
Yes.
right?
Yes.
You want to have as much balance in all of those areas as possible.
I like to relate it to those who have a heart condition. If you find out you have a heart condition, you could be at greater risk for a heart attack. So what do you do to prevent yourself from having that? You take all precautions. You make sure you take care of yourself with diet, nutrition,
Right. Eat healthy,
mindfulness, like
life-giving
you
food,
said, right?
mindfulness.
To help hopefully
drink
keep
plenty
those
of
risks
water,
down. I look at it
exercise.
as the same for suicide prevention.
Yeah.
Wouldn't you want to help take care of those risks as much as you can?
And sometimes that does include medication. And
Absolutely.
I do want to speak to that too, because I have so
Please.
many people come in and say, I don't want to take medication, it changes me, I don't want to have to rely on that to be
Yes.
somebody or something I'm not.
Yes.
And so to take the medical approach, I always say, if you had diabetes, would you have any shame or any reservation about taking your insulin? No. If you had strep throat, would you take your antibiotic? Absolutely. So if you need an antidepressant or a mood stabilizer or something of the sort to help with keeping you more balanced and keeping you healthier and less depressed and less anxious, then absolutely you should do it.
And there's a communication also with your provider, because the only one who knows how we feel is ourselves. We're the best expert that we
Yes.
can be. So that if we take a certain medication and we're seeing effects from it that we're not comfortable with or not normal for us, to be
Right.
able to communicate that so that the provider can then make some changes if necessary, try something else, work with you so that the tool of the medication can be,
Right.
it's optimal.
Yes,
Right?
because unfortunately it's not an exact science. And
It's not.
People
and
get
each of us,
frustrated.
chemistry inside
Yep.
reacts differently to different things.
And people can get easily frustrated and give up if, the first medication doesn't work or there are side effects or it's not giving them the full effect. But sometimes you do have to try a few different things and stick with it.
But from what you're saying is medication isn't always necessarily needed, but you want
Not
people to
always.
be open to it if it is needed, that it could be an excellent tool
Right.
along with the other tools that they're making positive choices related to their health and well-being.
I mean, there's never one answer.
There never
There's
is.
never one answer. It can be, some people can manage their depression really well using light therapy,
Yes.
with exercise, with diet, with probiotics and gut health.
Yes.
You can go to medication, you can pray. I mean, there are so many different treatments. And
Yes, being in nature.
Yes,
Being
absolutely.
outside and enjoying the
little
beauty of
vitamin
what's
D.
all around you.
Yes.
Doing what you love. You
Yes.
mentioned before dancing, music, different things related to that. Rediscovering that which you love. Finding out what really touches your heart and makes you smile and happy.
And the thing is, there's not always one big thing. It's not the car, the vacation, the raise. It's finding joy in the little things day
It's
in
true.
and day out. And I always use this analogy of a quilt, that when
Yes.
you look at a quilt,
Yes.
it's beautiful. It's
Yes.
a piece of art, right?
Yes.
And it can wrap you up and it can keep you warm. But if you look at it and you break it down, each little square contributes to the whole.
Exactly.
So day in and day out, you need to find the little bits and pieces
Right.
that you can stitch together so that you can wrap yourself up at the end of the day.
Exactly, because you're weaving your own tapestry and doing it in such a manner that it supports you and helps you to be whole. So let's talk about, as we summarize our program today, and ladies, you've been absolutely wonderful, about the different resources available for people. So let's go. In NAMI, what is available?
We have our the connectprogram.org, our website that offers a wealth of information for suicide prevention, but those who have lost a loved one to suicide.
Okay.
It also helps with teenagers and children to access as well. Then there's the NAMI NewHampshire.org website, where we can get information and resources for families who are affected by mental illness, their children, what programs there are for them in schools to help them function in school. Places like Allie mentioned, going online to find a therapist that could fit perfectly for you.
What about the Lifeline?
And the National Suicide Prevention Lifeline always.
What is that again?
1-800-273-8255.
And that is 24/7, ma'am.
24/7 answers right here in Lebanon, New Hampshire at Headrest.
And they give guidance right away.
Guidance
What
right
other
away.
24/7 opportunities are there?
The
Was one
there was one more, the crisis text line, 741-741. And the Samaritans have a line as well, don't they? I just don't know that number off
we
the
can
top
give
of
that
my
number,
head.
yeah.
We can get
Okay.
that number.
Yes, we
We'll
can
have a
list it at
list
the
to
bottom
give
of
you.
the
And
show.
we also have, for the survivors of suicide loss, there are 14 support groups
Okay.
that will help them in the state of New Hampshire.
Very good. Anything else?
Raise awareness and education, I think, is the biggest.
Just talk.
Talking about
Talk about it.
Just talk. It
Most
sounds
important
so
things
simple.
that you want people to do. Let's
It's
tell our
simple,
audience,
right?
start communicating. Start talking, start asking, what are the things that you begin to look for? What do you look for?
You look for, in terms of risk factors,
Yes.
history of mental illness, substance abuse or misuse.
Prior attempts
prior-
or suicide loss.
Okay.
Yep, suicide loss.
Changes in lifestyle, you were saying
changes in
before. What types
lifestyle.
of things that you noticed?
Job loss,
Loss.
relationship loss, any real perceived loss.
Interests that you had before that you no longer do.
Things that you love,
isolating
that
yourself.
isolating
not
socially,
being around, right.
being more and more alone.
Talking about wanting to die, talking about feeling like you're a burden, starting to give away possessions. It's not an exhaustive list.
But a very
But
important
It's a
list.
combination.
It's a
of
combination
many.
thereof. And go ahead.
That's what I was going to say. And we can actually provide you a list of something more comprehensive
That
if you
would
want
be
to
great.
put it up
That
at
would
the
be great
end.
that we could include on it. So we want our audience to know that it is not helpless, you're not hopeless, you're not alone. There are supports out there to help you and your families. To absolutely reach out to all of these supports. There are trained people there ready to assist in every way possible. And that to never hesitate to ask for help. Asking for help is not a sign of weakness.
Absolutely
It
not.
actually is a sign of strength
Strength.
and courage.
Yes.
Strength and courage, because we're not here to do this alone. We're here to enjoy the human experience together, right? And we know that together we can make a difference, and together we can all thrive. And that's what it's all about, helping each of us to thrive, to become who we're capable of becoming and having a wonderful life. I thank you both very much for
Thank you for
everything that
having
you
us.
do.
Having us, Yvonne.
Until
Appreciate
next
it.
time,
Really appreciate
thank you again.